In my practice, I've heard some really unusual things regarding intermittent fasting. They may not be perfectly true, and they are not false either, and these concepts may require more clarification. These are pretty big claims that intermittent fasting cures diabetes or cures cancer. So intermittent fasting that way helps the diabetic people, but cure is a pretty big term to use in this context. Diabetes is a chronic disease. It can go into remission, but a lifelong cure is certainly not possible. But that does not mean that you should not fast intermittently, because there are multiple other benefits. It will improve your immunity, it will help you fight infections, and it has multiple other cardiovascular benefits as well. So there are multiple benefits with intermittent fasting, but there are also some drawbacks which we should be careful about. Cortisol is a stress hormone, and that can in fact have some negative effects on our body. So per se, intermittent fasting, when used in the right way to improve the metabolic health, will not have a negative impact on various hormone levels in the body. Whenever we talk about metabolic health, we talk about weight loss journey, there are different components that we look at. One of them is the diet and intermittent fasting. The other component is exercise. The third component can be various medications, etc., stress management, and all those things. So these are two different things: weight management through diet, weight management through exercise. So intermittent fasting per se cannot be an answer or a replacement for exercise, but exercise of course can be an add-on so that you have a healthier life. You lose weight in a proper way, wherein there is no muscle loss, but there is more of fat loss. So simple things like even drinking water may not count as breaking the fast. So breaking the fast is a concept maybe which is more important for religious fasts, wherein it is very important that you avoid some things completely. But herein, a simple thing like food stuck in the teeth, or having a sip of water, or maybe even drinking something like green tea may not count exactly as breaking the fast. The benefits of this intermittent fasting are long term. They will not be undone by simple processes like these. So in the long term, the benefits would still be there, and I would rather suggest we not think of such trivial matters when we are going in for intermittent fasting. Intermittent fasting, when practiced over long periods, can have multiple benefits. Something that in medical terms we call it epigenetic changes. So that can help in the long term, but rewiring of the DNA is quite impossible. The hormonal milieu or the hormonal environment of the body is much better and much better equipped to fight common infections as well. In a nutshell, intermittent fasting does help with improving the immunity, but then we'll have to be very critical that it is not something that can replace various medications when required. So whatever information is needed regarding intermittent fasting, how to initiate, how to go ahead, whether you are the right candidate or not, and what are the realistic expectations from intermittent fasting, please consult an expert and then go ahead. Thank you.